Descubre tu potencial. Descubre tu nuevo tú. Descubre Lourdes University.
Hi everybody, welcome to Descubre Lourdes. This is Rafael, and today we have a wonderful guest. We have Dr. Sue Rosson, and I know she's very important at Lourdes, so can you tell us a little bit what you're doing here?
Well, I don't know if I'm important, but I am the director of the Nurse Anesthesia program here at Lourdes University. I've been here for about 7 years and in the director's position for a little over almost a year.
That's nice, yeah. So you are important. You have like a big thing here at Lourdes. And can you share a little bit about yourself and your professional side?
I graduated from a nursing school a long time ago when it was just a diploma program. We didn't have degrees like they do now. I worked for about 10 years in critical care in the intensive care unit in the emergency department before I even looked at getting into anesthesia. So with that background, I entered an anesthesia program that was, again, a certificate, was not based in a university. After that, because I'm a lifelong learner, or as my husband says, I love to be in school, I attended various other educational opportunities. I have certificates in legal nurse consulting. I went on to get my doctorate, and along the way, other courses, other interests were kind of piqued my interest. So I've done a lot in the way of professional opportunities and experiences. Mm-hmm. I spent approximately 40 years giving anesthesia, in addition to the years I spent in nursing.
And can you tell us about the master's degree program in nursing anesthesia?
Well, the nurse anesthesia program is a 28-month program. When the students finish the program, they will graduate with a master's degree in nurse anesthesia. The program has been in effect for about 11 years. We have graduated approximately 98 students, all of whom are employed here in the area. We have a current class that will graduate in December, and they're actually looking forward to it a lot. They can hardly wait to get into practice.
And how long this program is being offered at Lourdes?
We've been here since 2011. We have currently 9 cohorts. Our 10th cohort will be starting in, I think, next year in August. So we've been here for about 11 years.
Yeah, it's been a long time. And can you explain what is the difference between anesthesian and anesthesian physician?
Anesthesia physicians or anesthesiologists are physicians who specialize in anesthesia, and nurse anesthetists are nurses that specialize in anesthesia. We both have the same scope of practice. We both can do what needs to be done to provide anesthesia for our patients. But when you look at the preparation, physicians take about 10 to 12 years in school, accruing a tremendous amount of debt, whereas nurse anesthetists take 4 to 5 years depending on their program. So they have much less debt when they come out of the program. They are employed much quicker than anesthesiologists. They provide the same care, and many studies have been done to show that there is absolutely no difference in the quality of care that's given to patients, whether it's from a physician anesthetist or a nurse anesthetist. So besides that, there really is not a lot of difference between the two.
Does the nursing anesthesia do?
A nurse anesthetist administers anesthesia, also analgesia, and also amnesia, which means we basically take patients who are undergoing surgical procedures, whether it be surgeries or invasive procedures like patients that have cardiac catheterizations, moms that are having a baby. We give them pain relief and we make them comfortable during the procedure so that they don't feel pain and the surgeon can proceed with the operation that he's doing.
I know that graduating in this program has been very successful, so can you explain details about this?
Well, when you say successful, that has a lot of different meanings. But our students, when we talk about success for our students, we mean that they have gone through a very rigorous didactic and clinical experience. They learn a lot. It's very intensive. So they have the knowledge that they need to be able to be excellent practitioners or excellent administrators of anesthesia. As I said, it's a 28-month program, and when they're finished, they are prepared to practice or to administer anesthesia to the best of their complete scope of practice. The program is designed for to prepare the students, and to be successful, we really mean that they are able to practice to the full scope, but also it means that they are employable. Our students that graduate are 100% employed when they leave the program. So they all have jobs when they leave, which is, I think it's a pretty good indication of how our program prepares them to practice when they're finished.
Why did you decide to teach and lead in Lourdes program?
Well, I find that Lourdes University is it's a very inclusive, a very faith-based community, and I find that to be very, I find it to be a very good environment for students to learn in. And I think with the small size of classes that we have, we only take a maximum of 18 students for each of our classes, which is far lower than many classes in many other schools of anesthesia. And with the smaller number of students that we have, the instructors are able to give individualized attention, and they're able to establish relationships with the students. And I find that using or having that kind of a relationship allows students to feel more comfortable, and I think they learn better. They learn that they have a support system if they need it, and I think it makes them more successful as a student.
Okay, so thank you, Dr. Awesome, for being here with us and sharing what you know and what you're doing here, and we appreciate that.
Well, I feel very honored to be able to present to the community what nurse anesthetists do, and I would encourage anyone that's interested to look at the website, because everything is posted, and call the nurse anesthesia department or the graduate admissions department so that we can give you information to help prepare for your possible choice of nurse anesthesia. If you're just beginning your nursing career, we would gladly give you information to show you or to help guide you what courses to take, or we have individuals that we can have that you can shadow. So anything we can do to help the aspiring nurse anesthetists actually become interested in the program, we are more than willing to do. And it's been an honor and a pleasure to be able to talk with you and the community about my profession.
So if you're interested, you can just do what she said, just go to the website and they have information for you. And I hope you enjoyed this segment. I hope it was informative for you. And thank you for watching us. I'll be here next week, same day, same time, with more exciting things for you. And I hope to see you here on Descubre, Lourdes, Voces Latinas.